Hey Strong Mom Society. So today's workout is all about integrating your pelvic floor with midsection movements, which are more specific to movements in the obliques. So internal, external obliques, getting that pelvic floor integrated with twisting, rotation, side bending, things of that nature. So here is your corrective exercise for pelvic floor and torso obliques midsection. Right, first thing that we're gonna do is actually come down to our backs. If you are pregnant and uncomfortable in this supine or laying on your back position, I want you to grab yourself a few pillows and just prop up so you're in more of an incline. A beanbag works, pillows, blankets, towels, just so you're not flat. If you are comfortable there, you're totally fine to stay in that position. But what I want you to do is come down and set that breathing pattern. So we are gonna bring our hands to our lower belly. And I want you to inhale. You're gonna use your tools from those first foundational videos for just setting the breath, where we inhale into the lower ribs and belly. We're gonna exhale, and we're gonna start to engage the pelvic floor. So I want you to visualize a blueberry in the front, middle, and back holes. And I always tell my clients, you know those arcade games like the claw that comes down and it wraps around a toy and you have to get it back up. So think of your pelvic floor muscles as having those two functions, that the claw is gonna come down around those blueberries, and then it's gonna close around the blueberries. So you're stopping the flow of urine, you're stopping yourself from passing gas, and then it's gonna lift up into the center of the body from there. So we inhale, we release the pelvic floor muscles down, we open up, exhale, close, and gently lift. I've also heard the cue of using, and I've used this other places on the platform, of a handkerchief. If you think of your pubic bone at the front, tailbone at the back, sits bone side to side, you've got a shape of a diamond. Lay a handkerchief in that diamond. On your exhale, you're gonna gather all four sides, that's your close, lift it up. Inhale, put the handkerchief back down, and then space or spread out all the wrinkles to relax and open the pelvic floor. So whatever image works for you, if you have something else, by all means use it. The important thing here is that you're activating and integrating that pelvic floor. So exhale, close and lift. And if your hands are in your lower belly here, you're gonna feel the muscles underneath, from hip bone to hip bone, underneath your fingertips, tighten a little bit. Your pelvic floor muscles are connected into your deep core muscles. Inhale, release. So just use that as a reminder. The pelvic floor is the bottom of your core. This entire canister from pelvic floor to diaphragm is all interconnected. It all has to work in balance. Inhale, release, send that air all the way down to the bottom of the pelvis. That inhale, release is just as important as the activation that we're doing. So from either your incline or this position here, I want you to take a hand to an opposite leg. And as you breathe out and you go into that close and lift, I want you to find your scap engagement on this arm. So you're pressing down armpit to hip. You're lifting that pelvic floor, and you're gonna feel some core activation here. So if you've got your baby, you're pregnant, you're gonna hug that baby towards you as you lift that pelvic floor. We're never gonna push out and up with the abs. Postpartum, we're just trying to scoop everything up the front of the body. You're holding that press. You're pressing your hand into your knee into your hand, and we're feeling these oblique systems on the sides of our bodies. And then inhale, let that all go. That is work. Let's take the other side. You're gonna exhale, close and lift to get that leg up into chair. Opposite hand to opposite knee. Find that scap engagement at the back, armpit to hip pressing down. Knee into hand, hand into knee. That pelvic floor is lifted and engaged. Those obliques, those side abs are on through your inhale and your exhale here. We're just gonna take one more breath. Hugging those core muscles in. Good, and then release. And then just give your knees a little windshield wiper here from right to left to find a little bit of release in those hip flexors as well. We're gonna roll ourselves onto all fours, and we're gonna head into some bird dog activations. So if you've got any wrist issues, pop up onto your fists. You are also welcome to do this down on your forearms and just do some legs instead of arms and legs. But Ideally, we get those scaps on to get us out of that wrist pain. So we're always working for that scap activation to strengthen, to take tension off of the wrists here. Drop your armpits down towards your hips. Go through a full diaphragmatic breath with your pelvic floor engagement on the exhale. Breathing in, that belly drops down. Exhale, close and lift the pelvic floor. Feel those lower abs scoop. And then we are gonna reach the arm and opposite leg either to the floor, so both points are on the ground, or lifting up and away. And I want you to just hold this for 2 breaths. Inhale, fill ribs and belly. Exhale, dropping those shoulders down. Try not to let that shoulder creep up to your ear. One more breath here. And bring it back to center. These asymmetrical movements, arms and legs in the body, work the torso, the core, the obliques. So that's what we're trying to get to today. Shoulders on top of wrists. Armpits pressing down. Scap engagement is on at the back. Inhale, full release. Exhale, close and lift the pelvic floor. Feel that lower abdominal activation, full spinal and pelvic support here as you lift out. And then either holding that out position with both points on the ground or lift it up. 2 breaths here. If you're hyperextended in those elbows, I want you to rotate that elbow down. That's also gonna help you get that scap on, take pressure off your wrist. One more. And coming down. Good, I want you to just sit back in child's pose, extend those arms out, drop your head down to the floor, release your lower back here. Breathing into your back body. Trying to get your belly to drop between your thighs, trying to fully relax your pelvic floor at the bottom of this inhale. We're gonna come up to a kneeling position. If you've got bony knees, give yourself a little extra layer of padding, either with your mat or a towel underneath you. And then I want you to bring your hands to your shoulders. Now, I like to keep hands up here because if you take a breath here, you're gonna very dramatically feel that rise and fall. So just use these as an anchor to think of your ribs being closed at the front. We don't want them to be back here. Ribs on top of hips. And then also to find that scap activation so we're not here. So that there's a balance between that the ribs being closed and the scaps right here squeezing on. From this alignment, you're gonna take your exhale in the pelvic floor and you're gonna take a side bend on that pelvic floor activation. So the pelvic floor is lifting up, the lower abs are wrapping as you bend. Inhale, release back to center. Exhale, close and lift, side bend to the other side. Inhale, back to center. Pelvic floor, stop urine, stop gas, lift it in and up to side bend. Inhale, center. Exhale, close and lift. Side bend, back to center. We're gonna take this into rotation now. So hips are gonna stay facing forward. We're gonna rotate from the obliques. A lot of people in an assessment will do a rotation and they feel it in their traps or their neck. We actually want to teach our bodies to rotate from the side abs of the obliques by wrapping, lifting, and then going into that rotation. Inhale, fill. Pelvic floor relaxes. Exhale, close, lift, wrap. You can think of a corset wrapping all the way up the front of the body. Inhale, zipper comes off, buttons pop loose. Exhale, close and lift, wrap the core, then take your rotation. So when we're rotating to look around, put your seatbelt on, you're not straining from your neck here. We're actually using our abs so much during the day that we want to make sure that we're setting the proper mechanics. The bottom of the core canister, the pelvic floor, aids in that rotation. So when you go into those faster workouts that do some reaches, which we'll do at the end of this one, or some rotation, you've got this all on for you. You're not going to strain your neck. You're not going to put extra pressure or strain on the belly. So slowing all of these movements down now is going to save you from back problems, diastasis recti, pelvic floor dysfunction, all of those other problems later. Okay, let's get up to standing as promised. And I want you to take that same exercise of side bend rotation from here. Shoulders down. We're gonna start with the side bend, pelvic floor, lower abs. You should really feel this in your obliques. Inhale, exhale, close, lift, wrap, scaps down. Good, one more on each side. Inhale, release. Exhale, zip, wrap, side bend. Feel it in those abs. Inhale, release. Exhale, zip, wrap, side bend. And then we're gonna head into rotation. Same pattern. Exhale, zip, wrap, rotate. Inhale, back to center. Exhale, zip, wrap, rotate. Inhale, release the pelvic floor. Exhale, close and lift the pelvic floor. Wrap the core, rotate. Inhale, back to center. Exhale, release. Exhale, close, lift, wrap, and rotate back to center. You're gonna take that foundation that you just set, and we are just gonna take some reaches from right center to left center. And I want you to feel that rotation coming from the pelvic floor first, and then going up into the obliques as you reach. Now, at first, as you're trying to, remember, this is corrective exercise. You're training your brain to send the right signals to your muscles. So your timing for this might be extremely slow. That's okay. The important thing is that you start to set that foundation of everything firing, zipping, closing, lifting, and then we start to move faster. It's just like learning any other new skill, training any muscle for strength. You're training your brain right now to get this pattern right, because chances are you've done it incorrectly or just not had any focus or connection to it up until this point in your life. All right, when you're ready, maybe you take 2 rotations with an activation. Exhale, close and lift, rotate, rotate. Close, lift, wrap, rotate, rotate. Pelvic floor relaxes, stopping urine, stopping gas, wrapping those core muscles, keeping them wrapped through both rotations. Exhale, close, lift, wrap, rotate, rotate. We're gonna take one more. Pelvic floor, lower abs, zip, wrap it up, coarsen it up the front, rotate, rotate, and you're done. Okay, so again, this is all about connecting your pelvic floor engagement, that full core foundational function, to movements in the oblique, so we can start to rotate, flex, bend, move a little faster, and get you moving and feeling good.